Hey guys, this is Jeremy Pittman with Pittman Physical Therapy again, and recently we've been talking about common causes of lower back pain and sciatica. So far we've discussed bulging or herniated disc. We've also discussed degenerative disc disease, arthritis, or stenosis as it's called. But I want to talk about the third major cause of lower back pain and sciatica that's pretty sneaky. And this particular cause does not show up on an X-ray or an MRI. So for this cause, I wanted to show you guys the anatomy, so it makes a little bit more sense because sometimes it's hard to visualize. So as you can tell, this is the back of a person. So I'm going to strip down some layers so you can see actually how deep this really is. So a lot of things are going to pull up on the screen as I move them out of the way. So we're going to go really deep into the spine here. So we're going to go layer by layer, deeper and deeper and deeper. Now this cause right here, as I'm stripping these layers back, I want to tell you that this does not have an age range. If you remember in the previous videos when we were talking about disc problems, that age range is going to be typically between the ages of 30 and 50, 30 and 45. And degenerative disc disease, arthritis, stenosis, that's going to affect those over the age of 50. But this particular cause does not really have an age range. It's between the ages of 10 to death, quite honestly. So this right here is your gluteus maximus. I'm going to move it out of the way. It can cause a lot of back pain as well. But what we're going to be looking at today is the area right here. So you can see my mouse. I'm going to get a pen over here, and we're going to draw right here. Now that right there is called your SI joint. The reason it's called SI joint is because this bone right here is your sacrum. This bone right here is called your ilium. So sacroiliac joint, we shorten it down to say SI joint. Now, how does the SI joint get inflamed? Well, the number one cause we see for SI joint issues is postpartum females, because their pelvis has opened up to allow childbirth. And there's a lot of a hormone called relaxin in their system, which allows ligaments to stretch out. And after birth, sometimes those bones, after the ligaments have stretched out, don't go back exactly where they're supposed to. So it creates a lot of inflammation in that area. But any type of trauma to one limb or a fall can cause SI joint issues as well. So I'm going to take some of these marks off, and I'll move this guy up, just up a little bit. Move him up just a little bit, undo that last mark, and we'll get that pin back. So if you can appreciate, say you're driving in your car and you're in an accident and you have this leg right here on the brake, okay? Well, your femur bone comes right up through here and attaches to that pelvis right there and can shift this whole bone up, which can put a lot of stress right there on that sacroiliac joint. So that's one way. Stepping down the stairs when you think you're all the way at the bottom, that could be another way. You think you're at the bottom, you take that last step and you jam it. Or any type of lifting activity where you're not fully centered can cause a lot of problems there. So again, I want to talk about why this causes sciatica, because we're talking about one joint. How does that actually cause sciatica? I want to move this thing right here out of the way. This is your piriformis muscle. A lot of people talk about piriformis syndrome. That can cause a lot of sciatica, but not necessarily back pain. So that's more buttock pain and sciatica. So I want to move that out of the way. We can talk about that on another video. So let's hide that. But let's talk about this thing right here. That big fat nerve right there, that's your sciatic nerve. It controls most of the functions down into your leg. And it originates, I'm going to grab my pen again, it originates from the spinal cord up in this area right up here. Okay, here's your spinal cord coming right in the middle. right? So it originates up there, and all of these nerves come down and make the sciatic nerve. But you can appreciate where if you have a nerve coming out of this level, move this out of the way so you can actually see those nerves as they're coming out. So just a little bit deeper into the spine. So there you go. So you can see those nerves coming out right there. Those come down and form that sciatic nerve. Now, you can see how closely related that SI joint is to the sciatic nerve. So if that gets moved, it gets compressed, it gets pinched on, then it can cause some sciatica. And with that sacrum being in the position that it is, if it gets irritated, you can tell how that could affect these bones going up the back. Again, this particular cause of back pain and sciatica does not show up on an MRI or an X-ray. The only real way to find out if this is the leading cause of your back pain and sciatica is with a really good physical exam. There are 5 specific special tests that we do to figure out if your pain is actually coming from this joint right here with a 98% accuracy. So if you have any questions whatsoever about SI joint dysfunction, if you think you might have that, just make a comment below to this email or give me a call at 901-850-5246. If you have any questions, I'll be more than happy to answer any of those. See you in the next video.